Of Daytime Tri-Cities is sponsored by HMG. Well, good morning. We are here on location at Holston Medical Group Primary Care at Johnson City, and we are here today talking about the difference between family medicine and internal medicine. We're learning a lot here. We are joined by Dr. Cynthia Partain, and Dr. Partain, thanks for having us out today.
Well, thank you for having me.
Well, you are a family care doctor. Let's start there. You've been doing this for many years, and you love family medicine.
I love family medicine. It's still my passion. It has been for 30 years. It will continue to be so till the day I die.
You said your patients are like family.
My patients are like family. Anybody out there who's my patient, you know, most of y'all go way back with me, and they'll tell you. I take care of them. I take care of their mama. I take care of their cousin Betty. It was just family.
So how is family medicine different than from a traditional internal medicine that we might think about?
Well, when I was in medical school, you spend time in each specialty to get an idea and a feel. And what I loved about family medicine is it incorporated the psychological and social aspects of patient care. The medical part is very, very important, but it's useless unless you know how a person is living, if they're homeless, if they are living with an abusive relationship, if they can get their medicines filled, if their place of employment burned up last week. I mean, these are very important things to consider when you're prescribing medicines and looking at their health.
And one of the things I think about is that really takes that relationship building over those years, and I would imagine for you getting to know your patients, so you have that patience and that desire to learn more about them.
I think that most of my job, if I can talk to you and learn what's important to you and learn your situation, then I'll understand how to approach your medical care and give you the best medical care I can, because it's going to be different. Diabetes is different in everybody. Hypertension, depression, all these things I take care of. It's a different presentation. It's a different person, and it needs to be thought of that way.
So over the years, I would imagine you built some pretty strong relationships.
I did. I had a recent birthday, and I had several patients bring me treats and tea and cake and cookies and things like that. It's great. It's a great relationship I have with my patients.
And I liked how you said too, every condition is different. There's, even if they have the same disease or the same illness, fighting it individually is really important, because what works for some may not work for others.
That is true. It's so affected by your background, by your beliefs, by your support system. All these little things that make you an individual. And if you don't consider that, I mean, would you really want a rubber stamp on your hypertension treatment?
So if someone is looking to find a family medicine doctor, what are some of the things that they should consider going about that process?
Considering it from, if I moved into an area and I didn't know anybody, I would ask my neighbors. I would ask my community members, my church members, who they know and what they think, and then I'd probably follow it to Google and read reviews, and then I'd talk to them, and if I liked them, I might introduce the rest of my family to them. I think that's what I would do if it were me.
And you like still getting to know new patients and taking that time. It sounds like it really is just all part of your heart, your passion.
It is. It's how wonderful it is. I get to make a new friend every time I meet a patient, and if you talk to anybody, I can usually find something to like about them. I bet anybody could.
Well, thank you so much for taking the time to talk with us today as we learn a little bit more about family medicine.
Well, thank you. I enjoyed talking to you, Amy.
If you have any questions or you would like more information, you can always check out the website or the medical blog. It is holstonmedicalgroup.com. The preceding portion of Daytime Tri